Hey guys, it's Tara with McLean Mobile Wellness. First of all, I wanted to say thank you guys for supporting me in my business this year so far. It has been a whirlwind, but I think that we have been a helpful asset to the community to be able to provide some COVID-19 testing services for you all. Tonight, I wanted to come and just make a general informative video. It won't be very long, but I wanted to kind of touch base with you guys about the accuracy of different ways to swab. And so you may, if you've done my services before, then you know that if you are symptomatic, our recommendations are either the Nasopharyngeal Swab or a Oropharyngeal plus nasal. And there are many reasons for that. I also recommend that we do the swabs instead of you. I know that it's a lot more comfortable for you as the patient or client to do your own swab. Totally understand. The validity, however, of self-swabs is much lower. I have seen this not only in the literature, which I have reviewed extensively over the last few months, but particularly in the last few weeks with this huge spike. But I've also seen it not only in my everyday practice as a nurse practitioner, but also in our business here. So I'm going to give you a couple of examples. I had one client who symptomatic, who I came out and tested, and I did the Nasopharyngeal Swab. And what that means is that it goes in the nose, and we follow the track, the natural track of your nose as it hits the back of the throat. We do not go all the way back here. We don't pick your brain, as some have referred to. Is it super pleasant? No, but it should not be painful. And it is actually pretty short. It's quicker to get that type of swab than it is to do the nasal swab, which is just the front of the nose. If we do just the front of the nose, we have to do it for 15 seconds at least on each side. And so that seems to actually, in my opinion, and what I've seen is that it seems to be more uncomfortable for a lot of people. This is quick and easy, and it's over and it's done. But we do the nasopharyngeal. I do personally, as the healthcare professional, do the nasopharyngeal approach. So I did that for this one client, and she was positive. So unfortunately, her work wanted to confirm it with their own PCR swab, which is great because PCR is the gold standard, just as the Abbott ID Now is the NAAT test. And so they are equivalent. Unfortunately, when they redid their swab, they had her self-swab, and they sent it off, and the PCR came back negative. Then they wanted her to retest in order to return to work safely. When we went back out to retest her, she was still somewhat symptomatic, but feeling better. So later in her disease process, I would say, I can't remember exactly, maybe 7 to 10 days in, and I sent my other tester out to the home, and he did our other approach, which is the oropharyngeal, the back of the throat, very, very back of the throat, plus a nasal swab. And so the latest studies coming out about Omicron is that it's much more accurate to do a combined oropharyngeal plus nasal swab. So guess what? That test was also positive. So it goes to show that even though we did 2 different types of sampling, that it was more accurate than a self-nasal swab. There are many reasons for this. One is that it's just not comfortable to do on yourself, and typically people don't do it right. They don't do it well. So even with a gold standard PCR, she came back with a false negative test, which could have been detrimental had she taken those results and then gone out into the public or exposed her family members or what have you, or her coworkers. So, so that's one example. Another example that I'd like to give you is a client of mine who had done several COVID-19 tests with not only her healthcare provider, but also I think an at-home test. I think she had done 3, and I may be wrong, so if you're watching this video and you want to correct me, please do. But they were all negative, but she had classic COVID-19 symptoms, and she really felt terrible, and she really wanted some answers. So she reached out to me and agreed to meet her, and we did an oropharyngeal swab and a nasal swab. I did not even do the nasopharyngeal, and she was positive. So does it change anything for treatment? Necessarily no, except for a lot of these patients, when they get these negative tests, then they then receive a prescription for an antibiotic. Antibiotics are not helpful in COVID-19 unless you've developed a secondary bacterial infection. Antibiotics may also cause other issues such as C. diff, alteration in your gut flora, all kinds of other issues. Obviously, we don't need to take an antibiotic unless we truly need one in a bacterial infection case. So not only that, but she also got some answers as to why she felt so poorly. And thirdly, she then knew she needed to be quarantining and potentially saved several from getting infected from her own self. So she was very relieved to get those results that night. So I say all that to say that it is important how your swabs are obtained. There's been many studies to show that self-swabs are not as accurate. Do they have their place? Absolutely. But if you are symptomatic and you need some answers, then the most accurate way to do it is to allow me as the healthcare professional to do a nasopharyngeal approach, or one of my testers to do the other alternative, which is the oropharyngeal plus nasal swabbing. Those are more accurate. You're going to get what you paid for, which is accurate results in a timely manner. So just wanted to leave you with that caveat of thought tonight that I do believe in my business. I've even one time gone out to retest a patient that had previously tested negative that I truly felt was positive, and went out and retested her to make sure. So I truly believe in my product. I truly believe in my business. And I know that what we offer is helpful and accurate. So I do appreciate your time and watching this video tonight. I hope that it was helpful in helping you understand why we do the way we do things, and also to help you realize the value in what you pay for with McLam Mobile Wellness doing your COVID-19 testing. Don't forget, we also offer travel testing, which is also very helpful because we'd love to get everyone out traveling again. And so we come to you. It's convenient for you. You don't have to wait at some of the retail pharmacies, which we've heard nowadays their turnaround time is not within that 72-hour time frame that is required by most international agencies or countries. So you get your results in 15 minutes or less. We offer antigen testing, or we offer NAAT testing, which is equivalent to PCR. We have received feedback on our forms for travel, really not had many issues with travel, except for one client, and we got feedback on our forms, and we have really, I think, been very responsive for that. and I'm very excited as to what we can offer you guys in the future. So stay tuned. We have a lot to unpack in the next few weeks. I would love to come back and do another video soon, but I'm going to wrap this up. If you have any questions about the swabbing techniques that we have or why we do them, please reach out. You guys have a great night. Thanks.